Good morning, everybody. It's great to be here, so I want to thank the Community-Based Research Center for this opportunity. I'm coming to you from Toronto, where I live and work, traditional territories of the Huron-Wendat, the Seneca, the Haudenosaunee, and the Mississaugas of the Credit River. I am a bit of an imposter today, actually, because I'm presenting on behalf of Dr. David Brennan, who sends his love. Unfortunately, he couldn't be here today, and he is the principal investigator on the iCruise study. So just want to acknowledge the research team, the research staff in David Brennan's cruise lab, particularly Sagai, who helped develop this slide deck and led much of this analysis, which I'll be presenting today, our community advisory board, and funding from CANFAR, CIHR, and the Ontario HIV Treatment Network. So, iCruise, the main study objective was to examine the ways in which gay, bi, queer, two-spirit, and other MSM from across Ontario interact and experience sexual health outreach and information through online services and mobile apps. To participate in iCruise, you would have to identify as a male, cisgender, or transgender, had sex with a man in the past year, or be attracted sexually or romantically to gay, bi, queer, bi men. You had to be 14 years or older and live or work in Ontario, or had visited Ontario at least 4 times in the past year. In terms of the recruitment, there was a soft launch in the summer of 2017. Folks were recruited through Facebook, and then there was a full launch about a month later, where there were a number of ads on different hookup sites and apps, which you can see on the screen. And a total of 910 gay, bi, queer, two-spirit MSM completed 2 baseline questionnaires over a 2-week period. So the baseline questionnaire was quite large, and so it was split into 2. For this data that's being presented today, the objectives were to assess respondents' experiences of receiving poorer health services than other people from healthcare providers in the province of Ontario, and to examine the reasons why participants felt that they had received poor services from healthcare providers. So you can see the sample included, again, 910 respondents. Participants were asked whether they received poorer health services than other people, for example, at doctor's offices, walk-in clinics, hospitals, community-based organizations, sexual health clinics. And participants were also asked what they thought the reasons might be for them to receive poorer health services. And chi-square tests were used to compare characteristics of participants who reported receiving poor services with participants who did not report receiving poor services. In terms of some of the sample characteristics, that's a lot of text. I actually think they're broken down here. So we can see the age of the participants, sexual orientation. For the other category, that included two-spirit, queer, questioning, asexual, pansexual, questioning, or mostly straight respondents. You can see it was largely a white sample in terms of race and ethnicity, with representation following from East Asian, Southeast Asian, African, Caribbean, Black, Latino, Brazil, South American, and Indigenous. In terms of HIV status, most folks were, at this time, HIV negative, not on PrEP, and there was some significant representation for HIV status unknown in the sample. Education, it was largely a well-educated sample. However, you can see for income, most respondents were reporting incomes of less than $40,000 per year. So this was the question as it was asked in the questionnaire. terms of some of the results, 27% of participants reported receiving poorer services than other people from healthcare providers in Ontario. Compared to gay men who did not receive poorer services, those that did report receiving poorer healthcare services were more likely to identify as two-spirit, queer, asexual, pansexual, questioning, or mostly straight, be Indigenous or African, Caribbean, or Black, live with HIV, reside in Northern Ontario, report current symptoms of depression, and be sexually active, and so on. Here are the 10 most common perceived reasons for respondents receiving poor healthcare services. So you can see right at the top there, sexual orientation, age and mental health, HIV status, and so on. So to summarize for this analysis, about 1 in 4 of the participants in this sample in the iCrew study reported receiving poor health care services than other people. And they were Indigenous, Black, HIV positive, and residing in Northern Ontario were more likely to report receiving poor services. And the 5 most common reasons: sexual orientation, age, mental health, gender, and race. And I think the key takeaway here, and I'm sure it would be no surprise to anyone in this room, is that we need a much greater concerted effort to ensure more equity in the delivery of a range of healthcare services for gay, bi, queer, two-spirit, and other men who have sex with men in the province. And so I will leave it there and look forward to questions and discussion. Thanks so much.